to the Oral Health Podcast. We're here talking about something that we may have touched on in the past, but we're going to do a real deep dive into it because we are taking this week to celebrate the healthcare sciences. Now, that, of course, is very important and close to our hearts, being the Oral Health Foundation. You know, dentistry is something that we all care deeply about. And it's been in the news for not always the right reasons lately, especially, but we want to just take a second to talk about how to get into it, which I'm sure is a topic that many people are interested in. So, Karen, obviously you've worked in dentistry, oh,
Shh.
longer than I've been alive, really, haven't you?
Oh, oh
You know
no,
everything.
I can't believe you just said that. And some, to be honest. I'm not going to go into how long, but yeah, it's been a little while. I was a child, obviously, when I started. Um, but yes, things do change and then things stay the same as well. So, to get into dentistry, to get into be dentistry to be a dentist has always been pretty much the same. You good grades in A levels, normally A's or A stars they want.
Mhm.
Has to have a science, normally wants maths as well. But it depends on the dental school. So you'd have to look at the particular dental school. So, yeah, you're talking about sort of an academic pathway to get there, to get to your the three A levels and then applying for dental school, and that would be the same as most universities, going in and having an interview. Basically,
Mhm.
they are half fought after. There aren't a huge amount of places for the dentists to train. We keep being promised more training places and more dental schools, which would be great, so we could get more dentist training, which would be great because it takes 5 years to train as a dentist. So we're not kind of looking at the normal 3 years to get an undergraduate degree. So you are talking about a couple more years. So a little bit older when they're coming out, a little bit wiser, maybe. You never know. Yeah, you never know. Anyway, so yes, they're not coming out at sort of 21. They're a
Mhm.
little bit older, so it does take a little bit longer to train them. And then most of them go into a sort of foundation year, which means that they work for a year under the supervision of a more experienced dentist, not somebody sitting over the shoulder, but
Mhm.
in the practice with a dentist. So that in all can be about 6 years. That's on the premise that they pass every year, you
Yes,
know,
and
so it
do it
could be
full
extended. Oh, it is
studying.
a full-time study. Yeah, it's a
Yeah.
full-time study. So, I mean, anything really dental wise. I mean, you can work from being a receptionist if you don't want to work on the coal face, as they call it. A dental nurse, dental hygienist, dental hygiene therapist.
Mhm.
You could work as a laboratory technician, making sort of dental crowns, bridges, implants, dentures, that kind of thing. You could
And
be a clinic
orthodontic devices and orthodontists
orthodontic
and
devices, yes, or
orthodontic therapists, and
ortho.
there's so many routes you can
There
go
is. I
down.
mean, that there are. I mean, an orthodontist, a periodontist, those are specialists. So you have to be a dentist first, and then you would go on to specialize. So it's like being like when you're a doctor, you would go on to a specialized.
Hmm.
There is a lot of scope. I mean, in my day, we pretty much had dental nurse, hygienist, dentist, and then the specialities. So we were a little bit limited. And when you think of going in as a dental nurse, you might go in straight from school. You could do some A levels and then go in. You could I mean myself, I was trained to be a nanny and got to the end of the first year and then thought, actually, I'm not keen on children really. And there was a job advertised in the small town that I lived in, and there weren't that many jobs that came up in that small town. So I thought, dental nurse, I think I'll give that a go. And here we are now, um, quite a few several years later. So I kind of went in, and his standing joke was I got the job because I fitted the uniform. So I started the day after my 17th birthday.
Wow.
Um, I know, I know. And in those days you didn't have to take the qualification if you didn't want to. So I had been a dental nurse 6 years before I qualified. Nowadays you have to be working towards a qualification. So ideally you will have done it within two
Hmm.
years after you start. There are lots of apprenticeships around now, which is great. So you are sort of guided through your path to becoming a qualified dental nurse. There are college courses that you would go on. It's normally of an evening, some are a whole day. You kind of have to look at what's going on in your area.
Hmm.
But you can still find a job as a dental nurse. You would then have to enroll yourself in a college to start that off. But there are lots of places that you can get advice on being a dental nurse. You know, the British Association of Dental Nurses will give you lots of information on everything you need to know, really.
Yeah. They are a
Um,
really good resource, and
yeah, great.
obviously we work quite closely with them, and they are very good people as well, which is always nice because if you can
Hmm.
go to them with questions and they'll actually have the time to answer you, they want to. So that's quite
That's
rare,
right.
I think. So that's quite
Yeah.
nice.
I mean, the great thing about being a dental nurse these days, you can upskill.
Yeah.
So, for example, um, you can do your oral health education, which is what I did. You can also do radiography. You can do sedation. You can do, I'm running out now. What else can I remember?
Like fluoride varnish
Fluoride
applications,
varnish,
which is a
well
big one.
done. I'm testing you now, Sophie. Can you remember
You
any
are
more?
as well.
Yeah. We when we looked at courses, when obviously we were looking at doing the educational grant in Janet Goodwin's name, who people who didn't know who Janet Goodwin is, she is a much loved member of she was a trustee and she was our president uh, and she was a dental nurse predominantly, and she was a massive advocate and friend to all dental nurses. A very very positive lady, which unfortunately we sadly lost a few years ago. But hopefully we can leave a nice legacy for dental nurses in helping them to either do their dental nurse training or to upskill so that they can be, when you upskill, you are a great asset to your practice because it means that you can do so much more than, you can help your dentist out and you can do much more. You can go off and take the x-rays, you could do the fluoride varnish, you can do the oral hygiene instruction.
Yeah.
All
And
of
as
these
well as
things are
it being
such
a
a
good
help.
asset to the practice, it's a good asset for you as well. You get more job satisfaction out of what you're doing if you learn more and get to try your hand at new things. And you might find out, oh, actually, I quite like the thought of being a hygienist, or I quite like the thought of being a dental therapist. So
Yeah,
is
yeah.
that
Which you can
generally is the route that goes down? You don't just go in at a hygienist level. You start as a
no,
dental nurse and go up
yeah, you
and
work up from a dental nurse to a hygiene. Well, I think most of the courses now these days are hygiene therapist.
hmm,
So again, you would have to look at what their entry criteria is. As we said, entry criteria for all of them will be a registered and qualified dental nurse. So you'd be registered with the General Dental Council and you would have the qualification that enables you to be registered. So then you can go on and you can go to dental school and study to be a hygiene therapist. Um, the you can't then go on from a hygiene therapist to be a dentist. There was some talk of trying to upskill like that, but it gets mooted around all the time, but nothing seems to ever happen. So
it's not yet
um,
possible.
not
Yeah.
yet possible to do it like that. Well, I suppose you could. You would literally just have to apply for dental
You'd have to
school,
go back,
but
yeah.
you'd have to go back to dental school. It's not going to cut you any corners. You just probably sail through the first couple of years, maybe even longer, depending what you're doing. But yeah, so I mean, it is a really, really fulfilling career because we're not just a sort of drill and fill them, take them out kind of conveyor belt anymore. There's so much more about prevention and getting involved with the patients. I know when I first started, you work with a little old dentist who you should be seen and not heard. You never used to speak. And then right the way through to working with some very, very forward-minded dentists who treat you as part of the team, which hasn't always been the case with dental nurses, certainly. And them realizing your value and knowing that you could bring something to this party that we're having, we can do something slightly different. And I think patients quite like not having to talk to them person in the white coat. Sometimes it is, and that it could be any color of the rainbow coat, but the person with the sharp bits,
Yeah.
um they often are more open talking to a nurse, and if a nurse is talking to them about their habits and their oral health, etc., it is much easier. And generally we've got the time, and our time is cheaper, so why not utilize it's great. And that I think that's how we keep people in the profession, because there really is a massive problem of retaining dental nurses at the moment, um, probably due to um, not being particularly well paid.
Hmm.
Some of them, not all of them. I have to say, some of them are very, you know,
Fairly compensated.
yeah, you get a fair wage for a fair day's work, which is basically all we're looking for, really, isn't it? All of us. But there are some out there that it must be soul destroying when you can see people working in supermarkets with absolutely no responsibility, barely, and they're earning more than somebody that you have a lot of responsibilities being a dental nurse. You are, handing the dentist the things, the tools that they're going to need. You need to make sure that the records are all up to date. You've got to make sure that everything is sterilized and single use. And you've got a lot of, you've got to make sure that everything is in the surgery that is needed. You've got to look at stock control. You've got to look at, there are so many different things that you've got that um, deserve more than the minimum wage, I would firmly say.
Hmm.
Um, and I think it is something that we do have to look at, because until these things are sorted, you're not going to keep good staff, because you might have the best dental nurse in the world, but if you don't treat her well, you're not going to keep her. And then an agency comes in and you will have to pay more an hour. So if you've got a good member of staff, um, it pays dividends. I mean, I know from being a dental rep as well, because I didn't just stay in the surgery. I went off out on the road, and there's probably several of you listening to this that will probably recognise my voice, um, as I was coming around every 3 months. But I could always tell a nice practice to work at, because their nurses used to be there for years. Well, all the staff used to be. So you've got the same receptionist, the same hygienist, the same associate dentist, everything. And you could always tell that that would be a nice place to work. And then you go into others, and every time you go in, somebody new there. And that's just the sad reality of it, really. Retaining staff can be one of the most difficult things. But as I say, you've got to look after them. I mean, when you look at the foundation, look, you're looking at the Oral Health Foundation. We're always long stayers, aren't we? The foundation has, I think we're known in the industry as being, once you're in, you never get out. It's like with any job, isn't it? You have job satisfaction. And like I say, you don't have to be at the face end of it. You could be a dental receptionist, which again is a really rewarding job, speaking to people,
You're on
making
the front line,
appointments.
really, with the
Really
dental
are,
patients
really
because
are.
you're
Yeah,
fielding the
yeah.
calls.
You are fielding the calls. I like to think that dental receptionists are far nicer than doctors' receptionists, who have a very
Oh,
bad rap in my voice.
absolutely. They're nice people.
I just want to say, in defence, my doctor's receptionists are absolutely lovely. If they're listening, they are really lovely, and I genuinely mean that. I do genuinely mean that they are lovely. But when you're on the front line, you get a lot of abuse, and I can imagine in this time of difficulty finding dentists, they probably get it a lot, and I can imagine that. Um, we had it on the helpline. If somebody's in pain and you can't get them an appointment, which obviously we couldn't, we're not a dental practice, but you do kind of get it in the neck a little bit, and it's really difficult. And I think you do have to be a certain kind of person that can let it wash over you
Yeah.
and still keep smiling.
Yeah, I think that is a really good point of like you've got to be able to let stuff roll over and not
Yeah.
take it to heart. That's a skill I think across every healthcare um
Hmm.
industry, you know,
Definitely.
like
You know,
yeah.
when you're part of a dental team, and it is a team because you've got right from the front door till the go back out the front door as well. So they're seeing the receptionist, they'll see the nurse, they'll see the dentist, they might see the hygiene therapist, they might go back to the dentist, they might then speak to the oral health educator, they might see um, a dental nurse that does takes x-rays. You know, there's a lot of people that they might sort of circle through. And working as part of that team, it becomes a really well-oiled machine. And I used to love it when the dentist I worked with for many, many years, I could tell what she was thinking. I still can now, many, many years later, which is probably not great. But she'd ask for the wrong thing, and I would give her the right thing because I used to know what she wanted, or she'd have the wrong name for things. So if I was ever going to do my dental nurse spotter test again, I don't think calling a Mitchell's trimmer beaky spoon would probably wash it. And that's a dental joke there. You won't get that. I'll show you a Mitchell's trimmer and you'll know why I call it beaky
I
spoon.
think you have. I think you have.
Have
I've
I?
seen them
Uh-huh.
before. Yeah.
Yeah. Yeah. It makes sense to call it beaky spoon, I have to say. But apparently
That's
you
not
have
what
to
it
use a,
is.
that's not what it is. No, no.
But and as well, I spoke to a lady who you'll hear the interview coming up for Smile Month. She is a dental technician and spends a lot of time going through recruitment fairs and a lot of people that go, oh, I never even thought about this. I
Yeah,
didn't even consider that. And I think that's probably where the majority of people are when it comes to dental careers. They just
I
think
think
it's the
so.
dentist and that's it, whereas that's absolutely not the
Yeah.
case.
Yeah, and I mean, dental nursing certainly had a thing when, when we weren't allowed to be called dental nurses and we were just like, oh, that person over there. And I don't think we had the sort of professional recommendation from the patients either.
Hmm.
And I must admit, before I went for an interview, um, I'd never heard of a dental nurse either. I don't think I'd even noticed there was anybody in the surgery when I went for a dental checkup. I don't think I ever twigged that there was anybody there. And it was only because a girl at college said that that was what she wanted to do. Why on earth she was training to be a nursery nurse, I have no idea. But anyway,
People do tend to stick in the career for a long time, at least the ones that I've
they
met.
do.
And like
Yeah, they do.
our boss has been a dentist for how long? Like decades and decades, right?
Well,
He's in his 70s, isn't
oh,
he?
yeah, it's got to be 50 years, hasn't it? It's got to
Something like
be.
that. And it's like
Are we
this is not the
coming
kind
up?
of job
Yeah.
you stick to if you don't like it or you don't care about it or you're not
Well, it's a
passionate about
vocation,
it.
isn't it? You know,
Yeah.
if you're a dentist, a doctor, and you've trained that long and spent that much training, it's something that it's not something that you've gone, right, let me have a look and just see what I could do. It's got to be something that you have a passion for because it takes a long time to do it. It's
Hmm.
also a really, really creative job as well. And people forget that when a dentist is doing something, they are being very creative because they're looking at the shape of the tooth, they're making the filling match the tooth, they're looking at the colors when they're doing shades, and when they're doing crowns and bridges and dentures, they've got to design things. So it is a very creative, as well as a healthcare profession. So you've got to have that bedside manner as well.
Yeah.
So it's a bit of both, really.
Yeah. And I am absolutely fascinated by dental technicians that make these absolutely
Yeah,
stunning dentures and bridges
they're
and they
so
look
pretty.
beautiful. And they are artists. They're working
Oh, they
on
are
such a small scale, but
absolutely.
it's artistry. It's
Yeah,
like
it totally is.
that's the
And
bit of
mixing the
dentistry that I've fallen
colours.
over, absolutely.
Yeah, yeah. I mean, in my day, it used to be like Igor in the lab, but they are a little bit different now. They're not sort of like, it's not like Carry On Screaming or anything. They are a little bit. Yeah, we had a laboratory attached to one of the dental practices, and I just picture this guy who, I mean, to us when we were young, he must have been about 300, and we used to have to go and take study models down there, and he was just the strangest person. So that's why, like, it's Igor in the laboratory doing some funny tests while we're not there, kind of thing. But totally different these days. I mean, it is such a refined technique of mixing things to get exactly the right shade, and that must be really satisfying. Not, I mean, I suppose they never see the patient, which is, I
I
wonder if they
mean,
recognize it out in the street.
oh, that's a good question. I'll have to ask.
Ask,
I
yeah.
wonder if,
If
yeah, because I
somebody
imagine if you're
smiled
working
at
in quite a
you,
small area
yeah,
and you'll say,
if
oh, I
somebody
remember
smiled
that.
at you, would you recognize a crown or a denture that you'd done?
I'd love to know the answer to that question.
Yeah.
I'm actually going to see if I'm going to email the girl I spoke to and be like, just what? She'll think I'm an idiot, but I'll message
Well,
her.
why not? We can ask that question. But a clinical dental technician is also an interesting one. This is a relatively new person within the dental team. Now, a clinical
Mhm.
dental technician works in the laboratory like a lab technician. However, they can make dentures for patients directly. Directly if the patient has no teeth at all. So if somebody is completely toothless or edentulous, as we call it, so if they've got full dentures, they can actually just go to a clinical dental technician and they can make their dentures for them. They don't have to see a dentist.
Wow.
However, if they've got some of their own teeth and it's a partial denture they need, they would have to go to a dentist first so that they can have their mouths checked, and what the clinical dental technician needs to see is that they are dentally fit. So they would have to get something in writing from their dentist to say that they are dentally fit, and then they'll be able to make partial dentures for them. So that's another avenue for patients to get treatment.
There's just so many different avenues that you can go down
Yeah,
with a dental degree, a dental job, and it
yeah,
people will always need dentists. They're always going to have teeth, and so they're
yeah,
probably always going to have problems with their teeth, and even or need to know how to keep the teeth healthy if we want to go down the prevention route. This is not a career that is going to fizzle out. If anything, we need more of
no,
them. And if you ever have a question about going into dentistry or not knowing if it's the right thing for you, or you just want to learn more about it, get in touch with us, because even if we can't help, we can know exactly where to point you, because we are very lucky to work with lots of different areas of the dental profession. So the likelihood is we know someone that can support you. And
yeah,
if we can do
yeah.
that, then I'd love to. Just drop me a line. It's all right.
Yeah, drop her a line and she
Yeah.
might be able to help.
And
Yeah,
I'll put you on
also
to
you
Karen.
could you could also see if you could just pop in and shadow somebody at the dental practice. I know
Yeah.
some practices don't like that very much, but you never know. You could ask them if you could just have a look what goes on, even if you can just sort of sit in reception and just see the people coming in and out and just seeing what
Get to know
everything
some of the
entails.
conversations that are happening in the
Hmm,
practice, because they'll talk. I don't know, to be fair, if this happens behind the scene in the dentist. I know it did where I used to work, where you come through and people will be chat, oh, the last person I've seen, oh, this happened, this happened, this happened. And you learn things just by being around people that are seeing patients, which I don't know if the
yeah.
same thing.
And it's also, I mean, it is really nice if you work in a practice where they do a really wide range of treatments. So, for example, if they're doing implants and oral surgery and that kind of thing, um, if you could pop in there, oh, would you mind? I haven't seen that. Can I come in and assist? Can I come in and just watch so that you can learn things so that you're not kind of stuck with one dentist that really doesn't do anything other than just normal work. But
Hmm.
I mean, obviously, there is a massively growing need for people to look at the prevention side. So that's all very uh, that is that's what holds my interest, trying
Yeah.
to educate people into just having teeth for life and having comfortable mouths and you know teeth that work, etc. So that is a huge part of dentistry these days. We don't look at just repairing things. We want to teach you how to look after your teeth so that they don't need that repair in the first place, which would be
Yeah.
great.
Absolutely. And this is something that we could talk about for ages, but it's just nice to sit and dedicate some time to talking about all the different things you can do in dentistry because um yeah, I think it often goes undershadowed a little bit. So yeah, it's just good to
Mm,
just sit and
mm.
talk. So thank you, Karen, for joining. I'm gonna let you get back on to being a really, really busy, amazing dental nurse, and she sat yawning across
Oh,
from
I'm
me.
so tired. I'm so sorry. Yes, I've got so much. I'm obviously working with the foundation. It gives me the best of every part of the dentistry world,
That makes you the perfect person to talk to about this because you have
probably.
seen most things. So
Oh, and
it's
some that
always
you wouldn't
good.
want to see again.
And I'll let you get on. And thank you very much
Thank
for
you.
listening.
All right. Thank you.